Good morning, everyone. My name is Ricardo Romero Morales. Soy oficial principal de información pública para el Condado de Santa Clara. I'm a public information officer with the County of Santa Clara. Today, we are here to provide you with an update and review of the status of COVID-19 in Santa Clara County. Today, we have the honor to have Dr. Cody, who is a public health officer for the County of Santa Clara. And we will start in English, then we'll pause and take questions in English, and then we will move into the language component of our press conferences. Well, without any further ado, we'll go ahead and get started. I welcome to the podium Dr. Sarah Cody.
Good afternoon, everyone. Happy St. Patrick's Day. I'm not wearing green, but when I have my mask on, I have a little green, so. But I appreciate all of you celebrating. So I just wanted to give you a little bit of an update. 2 years in, where are we and where are we going and what does it mean? But first, on behalf of the County of Santa Clara, I first want to express my enormous gratitude to our community, to everyone who lives in our community, and to everything that everyone has done collectively together to keep all of us safe. It's extraordinary, it's tremendous, it's humbling, and on behalf of the county, I just wanted to really, really thank everyone. Because of the efforts of everyone and the way that we have pulled together as a community over these last 2+ years, we've made a significant difference. I think we can see this most clearly in the lives that we have saved. We have lost 2,180 people in our community to COVID to date, but without the collective efforts that we all have made, we would have lost many more. We looked at the rates across the country, and if we apply those to our community here, we can see what a difference we've made. We have saved over 2,000 lives here in the County of Santa Clara. And the data are here if you want to look at them more closely and ask questions. So just to highlight some of the actions that we've collectively taken. We stood up mass vaccination and vaccination in many different ways, and our community responded. And as a result, we have over 85% of our whole population is vaccinated, and almost 70% of people who are eligible have been boosted. And people stepped up early and often to get their vaccines. And that has saved lives and made an incredible difference. But even before we had vaccines, when we asked our community to shelter in place, when we asked our community to wear masks indoors, when we asked our community not to travel and not to gather, our community followed public health guidance and did those things. And that is how collectively we've been protected and we have stayed safe. So mostly what I want to do today is just to say thank you. I don't think I can say that enough times. And this is the result that we have. So right now at this moment, I think in our county, we are in a pretty stable place. Of course, we're not without COVID, but our levels are relatively low. We know this through our case rates, our positivity rates, and my favorite surveillance system, the wastewater surveillance system, where we see that levels are pretty low, and that's good news. But, and there's always a but, we still are in the middle of a worldwide pandemic. And even though many messages out there are, we're moving on, the virus hasn't moved on. And the virus continues to mutate and change and reemerge in different corners of the world. And so we actually need to keep doing many of the things that we're doing, looking out for each other and keeping each other safe. And I have great faith that we will continue to do that. So I wanted to share with you a few things that we're looking at and looking out for. One is the B2 lineage. So this is a sublineage or a little variety of the Omicron. It spreads even more easily than Omicron, and we are seeing it, quite a bit of it. It's increasing in prevalence across the country and in California, and particularly in the Bay Area. We can detect this in our wastewater, and we're seeing, for example, in the northern parts of our county, the wastewater that we follow, most of the Omicron is this B2 sublineage. And then it gets less prevalent as you move south. So not so much in Gilroy and quite a lot in Palo Alto. Interestingly, and this gives me hope, it is not driving up the levels overall. So I don't know why, but it isn't. But we're watching that very, very carefully here and elsewhere. Second thing we're watching is how will our healthcare providers step up? Our healthcare providers, our hospitals have been phenomenal taking care of people when they have COVID, but everyone in our community needs to ensure that vaccination and testing are ready and available to all, always, and particularly when we have surges. And finally, we're watching our partners at the federal government. Right now, COVID funding has essentially collapsed. That is breathtaking and shocking. We're in the middle of a global pandemic, and federal funding has collapsed. So we're watching that. I would say that this isn't a new place for our county. I think our county has been gritty and scrappy and dedicated, and we have done everything that we have been able to do in spite of what's sometimes been happening at other levels of government. And that's what we'll keep doing because our primary commitment is to protect the people that live in our community. So we will continue to do what we can as a county, as in a community, but there are also things that we want each and every person, every individual to do, because these are things that people can do to be prepared. First is, think about what kind of tests you have available in your home. So those free tests from the federal government are available. Every single person should order up their 4 free tests and have them at home in your little personal stockpile. They're free, they're available, there's no reason not to do it. Second, while we still recommend indoor masking, masking in other places is not necessary. Many people are masking less, but it doesn't mean that you shouldn't have a really robust stock of masks in your home, because there probably will come a time when we're going to need to wear them much of the time if there's another surge. So now's a great time to get prepared with masks and tests. And finally, I think this is something our community has done. If there's anyone you know who's not yet vaccinated, please talk to them and try to understand what's holding them back. It's probably pretty complicated. It's probably maybe a little bit delicate. But if there's anything that you can do to get an additional person vaccinated, it's important. Boosters, also important, anyone who's not been boosted. I anticipate that in the near future, we may have boosters recommended, another booster recommended for people 65 and up perhaps. It's going to be important that everyone in that age group gets boosted when it becomes eligible, because this saves lives. So the future, the future remains a little bit uncertain. I think we've gotten a bit accustomed to that. But at the same time, I do feel optimistic. And one of the reasons I feel optimistic is because of how our community has pulled together collectively. And I see that carrying forward. And I'm grateful. So thank you, and I'm happy to answer questions.
We'll start over here with ATBU.
What has doctors in the county, what have you learned from the last 2 years that what works, what doesn't work, and what do you want the public to have learned about all the pandemic influences?
So much has changed in the last 2 years, and one of the things that's changed is how much we know now that we didn't know then. When I think back, 2 years ago, for example, when I stood with fellow health officers to announce that we were asking everyone in the Bay Area to shelter in place, we were inside and we were not wearing masks. Think about that. Just think about that. I mean, right? We've learned so much. And when we need to, universal masking indoors, that requirement prevents infections and saves lives. We in the last 2 years, we've gotten not one, but many very effective and safe vaccines. That's phenomenal. And we now have scaled testing, not one test, but all kinds of different tests. You can get tested at home, you can get tested at school, you can get tested at work, you can get tested with your provider, you can get tested at a community site. And that's huge. So I think the public should feel reassured that we have so many different tools now and that we know how to use them. And at the same time, the public also needs to understand that the pandemic isn't over, and there will be times when we have to use a lot of these tools when to get through another swell or surge. We don't know what's ahead.
You said federal funding has collapsed. Are you still getting good support from the state?
The state have been fantastic partners, and I think a lot of funds, they flow from the federal government to the state government and to the counties. So I think that the state is really in a similar position as we are, in that these, at the moment, no federal funds coming forward. That being said, previous rounds of federal funding have flowed through the state to the county. And they have enabled us to hire extra people, to fill out our teams, to reinforce our infrastructure. And we now have an infrastructure that feels good. But the key is we have to maintain that infrastructure. We can't let that infrastructure erode. It's really important to protect the community and to keep us all healthy. So that's what we need to do.
Jet was going on. I don't know if you actually addressed this. So why has the federal funding collapsed? Is it because they feel as though progress has been made, or we ran out of money? I mean, why did it collapse?
I don't think I can answer that question. I think that's a question for someone at the federal level. But the administration had asked for funding, and there was a lot of COVID funding as part of an omnibus bill that just fell apart. So I think we all need to really hope that some funding gets back on track. We need it for vaccines, we need it for tests, we need it for treatment, and we need it for basic infrastructure in local public health.
But there's been no explanation, or
Not that I don't have an explanation.
BBC?
With what you're seeing with the BA2 variant, is there concern that will turn into a case spike? I know you said you're not sure why it hasn't, and will that lead to any restrictions in your opinion?
So I want to sort of step back and paint a picture for you, because there's always many different forces at play. So one force at play is any new emerging variant, and this BA2 more transmissible. That's one force at play that could really increase our community prevalence. Vaccination rate is another. We're fortunate in that we have a really good foundation. And another is human behavior. So we don't require masking indoors, but we recommend it. We basically don't really have any restrictions, although there are basic safety things that we recommend. So how we collectively in our community or in the Bay Area behave will have a lot to do with whether another variant takes off or not. The good news is that so far what we're seeing in our county is that we've got quite a lot of BA2, But right now, our cases and all other indicators are either slowly declining or flat. So hold that good thought.
So, we have been here like there is shelter in place. So, what people is thinking right now is possible that if we have like a new surge, can we go back to a shelter in place? What about mask mandates? So, is that a possibility, or there's like a plan in place if we have a new surge coming?
I don't see us ever going back to a shelter in place, and I'll tell you why. When we issued our shelter in place order 2 years ago, we had very few, if any, tools. We didn't know a lot about how the virus behaved, so there's a lot of information we were missing. Masks were hard to come by. We had very few tests, and very importantly, we had no vaccine. So we didn't have a lot available to protect the public. In contrast, now we've got vaccines, we've got boosters, we have lots of information, we have widespread testing, widespread availability of masks, and we know what to do. So we're not going to have to shelter in place. We can keep ourselves, our families, and each other safe in other ways. And that's by layering, the layers of protection. We will use the layers of protection, and we don't need to shelter in place again. So we're in a much better place than we were 2 years ago.
Santa Clara County consistently, have some of the most strictest restrictions because of COVID, and this has caused, you obviously know a lot of criticism, a lot of frustration. Would you have taken a different approach if you can't do it anymore?
What we have always done in our county is to look at the evidence that we have at the time, look at the science that we know at the time, and have the evidence about what's happening in our county and the science as it is known, and have that inform our policy choices. And I wouldn't do that differently. That is what I would keep on doing. Our policy choices at times have been different than other counties. At times they have been more strict, and at times they've been less strict. It's been mixed. It's not been universally more strict. What we always do is look at the evidence and look at the science. There's always uncertainty in our decisions. That's the way public health is. But we do our very best to make policy decisions that are going to be most health protective for our community.
I wanted to address the healthcare providers. So I know a couple months ago there was a health order put out that healthcare providers had to provide access to a test within 24 hours. And this was surrounding concerns that they weren't really stepping up in testing. Did you find with the Omicron surge that health providers actually did step up because of this health order that was put in place? And going forward, how are you planning on making sure that when there is, a surge or a swell or whatever it is, that they continue to keep stepping up and providing testing?
There is still an active health order. I have not rescinded it around testing. We need to ensure that all of our healthcare providers are serving their patients. And during times of surge, there's much more demand for testing, and one entity alone can't meet the demand. We all have to pitch in together. And the order is there to ensure that the healthcare providers are doing their part, and more importantly, that everyone in the community has rapid access to a test when they need it. That's really the critical underlying issue. Same goes with vaccinations. We need to ensure that every single person in our community who wants a vaccine and is eligible for a vaccine gets a vaccine with no barriers, period, full stop.
You have a couple more questions? That's it. Thank you, everyone. Oh, one more. Sorry. Go for it.
Actually, something that you just mentioned. So you made another pitch for people to get vaccinated and try to convince anybody else that get vaccinated. Is the number of people, the percentage of people who have not gotten vaccinated, still holding a
Yeah, I would have to double check the statistics, but I believe that we are still the most highly vaccinated large county in the entire country. So our vaccination rates are relatively high. 85% of our whole population is vaccinated, and over 90% of people who are eligible. And that is fantastic, really fantastic. That gives us a level of community protection that I believe is going to hold for a while. But it still doesn't mean that that we wouldn't be even better off if more people were stepped up to get vaccinated, because that protects them, it protects the people in their household, their workplace, their school, and the community. So more is better.
And one final question for Karina.
Yeah, you mentioned that the county calculated that they saved the lives of 2,000 people. How did you get that?
So we, please look at the graphic. No. We looked at the over the course of the whole pandemic from February 2020 to present, how many people died in our county given our population, and then we looked at the same for the state and the same for the country, and so it sort of gives you a rate that you can apply. And when you apply those rates, you see what would it have looked like if we had the same mortality rate as has been experienced on average across the country. And that's how we came up with the numbers. And both the rates and the numbers for the county, the state, and the country are here.
Thank you, everyone. Thank you, Dr. Cody. We will now begin the Spanish portion of the program.
All right, thank you, Dr. Cody. We'll wait one more minute. Muy buenos días, mi nombre es Ricardo Romero Morales, soy oficial principal de información pública para el Condado de Santa Clara. Primero que nada queremos desearles un feliz día de San Patricio. El día de hoy nos reunimos aquí para proveer más información acerca del estatus del COVID-19 en nuestro Condado de Santa Clara. Como sabemos, el Condado de Santa Clara el día de hoy, 17 de marzo, marca ya 2 años desde que la orden de quedarse en casa entró en efecto. Esta orden se puso en efecto debido a que estábamos viendo casos de COVID-19 y estábamos en esos momentos aprendiendo más acerca de este nuevo virus que en ese entonces le llamábamos el novel coronavirus. Desde ese entonces, con la orden de quedarse en casa, pudimos salvar más de 5,000 vidas. Y a este número llegamos gracias a comparar los números que el estado actualmente ha tenido comparado con los números que el condado ha tenido. Más sin embargo, hemos perdido más de 2,000 personas que vivían en nuestro condado. Estas personas son vecinos, amigos de nuestra comunidad, miembros de nuestras familias, quienes ya no están con nosotros. Todos en nuestro condado y en el país y en el mundo hemos pasado momentos difíciles, momentos que tal vez no nos imaginábamos que estaban por venir hace 2 años. Lo que sabemos hasta este momento es que gracias a los esfuerzos y colaboración de nuestras agencias hermanas, de nuestras escuelas, de nuestros negocios, de nuestra comunidad, hemos podido llegar a un lugar en el que el día de hoy no tenemos que usar mascarillas en los exteriores. También es muy importante mencionar que en ese entonces, hace 2 años, no teníamos vacunas. Las pruebas eran escasas. Era muy difícil hacer una cita con los doctores y mucha gente no sabía cómo reaccionar. Había momentos en los que tendríamos que comprar alimentos por varios días porque aún no sabíamos a lo que nos estábamos esperando. El día de hoy estamos muy contentos de anunciar que al menos el 85% de la población del condado de Santa Clara ya está completamente vacunado. y aproximadamente el 70% ha recibido su dosis de refuerzo. La gente ha adoptado las capas de protección que hemos mencionado aquí en el Condado de Santa Clara. Estas capas de protección incluyen el uso de las mascarillas, el mantener nuestra sana distancia, también el decir no a reuniones o el decir no a viajes en cuanto teníamos un alto número de casos o cuando el virus estaba arduamente circulando en nuestra comunidad. Por ello, les damos las gracias. Queremos darle las gracias a todos ustedes como miembros de los medios, a nuestra comunidad, a todas nuestras organizaciones hermanas, las cuales en estos momentos también han hecho un gran trabajo para llegar a nuestras comunidades, especialmente a nuestra comunidad latina, la cual ha sido impactada por este virus de COVID-19. En estos momentos lo que estamos viendo es que estamos en un lugar estable. Las tasas de casos y las tasas de positividad están a la baja o planas en estos momentos. Lo que sabemos también es de que existe la posibilidad de ver nuevos casos de coronavirus o de COVID, nuevas variantes que pueden circular. Hasta el día de hoy existe una subvariante, la cual le estamos llamando BA2, la cual se está convirtiendo rápidamente en la variante dominante de aquí del Condado de Santa Clara y otras partes del mundo. Toda esta información la estamos viendo debido a que estamos también colectando información de las aguas de desechos que salen de las casas. Ahora, una vez ya mencionado esto, también queremos mencionar y hablar acerca de los proveedores de salud o de atención médica. Como saben, durante estos 2 años hemos trabajado arduamente con agencias hermanas, con clínicas de la comunidad, con hospitales privados, para que también nos ayudaran a llegar a nuestra comunidad. Primero que nada, queremos darles las gracias, porque juntos hemos salido adelante durante toda esta pandemia. Ahora, los fondos federales se han derrumbado en estos momentos, y esto nos pone a todos en riesgo. Estamos en un riesgo de entrar en un ciclo de pánico y negligencia. Una vez más tendremos que profundizar localmente y hacer lo necesario para seguirnos protegiendo los unos a los otros. También esto va a depender mucho en nuestra comunidad. Nuestra comunidad ya ha hecho mucho en adaptarse a todos estos cambios al seguir usando las mascarillas en lugares cerrados cuando se han indicado, el ponerse la vacuna de refuerzo. Mas, sin embargo, les queremos recordar que posiblemente habrá momentos en los que tengamos que volver a usar estas mascarillas en interiores si es que existe una nueva ola de casos. También queremos pedirles que si aún no se han puesto las vacunas iniciales de COVID-19, que se las pongan. Ya sabemos que estas vacunas nos ayudan a prevenir enfermedades severas, hospitalizaciones e incluso la muerte. También, si ya califican para obtener la vacuna de refuerzo, también les pedimos que por favor se pongan la vacuna de refuerzo lo más pronto posible. El Condado de Santa Clara, junto con los oficiales de salud, continuarán monitoreando la situación y continuarán haciendo sus esfuerzos para traerles toda esta información a nuestra comunidad. Muchas gracias. All right. And we will now go ahead and move into the Tagalog portion of this press conference. So we will welcome Sherry Ann to our podium. Thank you.
Magandang hapon po sa inyong lahat. Ako po si Sherry Ann Mangligot, ang inyong Public Information Officer dito sa Santa Clara County. Nais ng County ng Santa Clara na magpasalamat sa publiko para sa mga inyong pagsisikap sa buong pandemya ng COVID-19. Dahil sa inyong pagpupursigi, tayo ay ang pinaka-nabakunahan na malaking county sa bansa na nasa 85% at 70% ang nagkaroon ng booster. Kahit na lahat ng ating mga layer ng proteksyon sa panahon ng COVID-19 ay nasa atin, tayo ay nawalan ng mahigit sa 2,000 ng ating mga residente dahil sa pandemya. Kung ang bilang ng ating mga namatay ay pareho sa antas na katulad ng natitirang bahagi ng bansa, tayo ay maaaring nawalan ng mahigit sa 5,000 buhay. Habang marami sa mga layer ng proteksyon ay hindi maginhawa sa mga panahong iyon, gumanap sila ng mahalagang papel sa pagligtas ng libo-libong buhay sa Santa Clara County. Dahil dito, kami ay nagpapasalamat sa inyo. Kayo ay nagprotekta sa ating mga pinakamahinang komunidad, sa inyong mga kaibigan at sa inyong mga pamilya. Tayo ay nakahanay pa rin sa estado ng California hinggil sa pagmamaskara sa panloob na lugar. Mariing inirerekomenda pa rin ang pagsuot ng maskara sa mga panloob ng espasyo ayon sa estado ng California at ng county. Inahasahan namin na magkakaroon ng mga pagdami ng kaso sa hinaharap, mula man ito sa kasalukuyang variants o bagong natuklasan na variant. Napakahalaga sa ngayon para sa ating mga lokal na healthcare provider na gawin ang kanilang pantay na bahagi sa pagsusuri at mga pagbabakuna. Gaya ng pagpunta ng publiko sa kanilang healthcare provider para sa bakuna sa chickenpox, tetanus at trangkaso, dapat silang madaling makakuha ng COVID-19 test at mga pagbabakuna. Marami ang nagtatanong kung magkakaroon ng kinakailangang karagdagang booster. Tayo ay susunod sa payo ng CDC at maging handa sa pag-alok ng mga karagdagang booster kapag ito ay inirekomenda. Magpatuloy po tayong sama-sama bilang isang komunidad upang protektahan ang isa't isa. Narito ang mga dapat gawin upang manatiling maging handa at mapigilan ang pagkakaroon ng sakit. Mag-ipon ng home antigen test at kung kayo ay kabilang sa 10% ng kwalipikadong mabakunahan at hindi pa ito nagagawa, mangyaring magpabakuna o magpa-booster. Hindi natin mahuhulaan ang hinaharap, pero alam natin na kapag darating ang mga pagsubok, alam natin kung paano nagkakaisa bilang isang komunidad upang protektahan ang isa't isa. Maraming salamat po. And now I will call on An Chang for the statement in Chinese.
大家好，我是圣塔克拉拉县紧急行动中心的 nhật。在历经新冠大流行2年之际，圣塔克拉拉县要感谢大家在这疫情期间对于防疫的配合和努力。由于大家的积极防疫，圣塔克拉拉县的疫苗接种率为85%，是全国大型县里疫苗接种率最高的，加强针接种率也达到了70%。就算在疫情期间实施了多层的防护，我们还是不免失去了社区中超过2000条宝贵的生命。但是如果我们以全国新冠的死亡率来算的话，我们失去的就不止2000了，而是5000。虽然这些保护多多少少对我们的生活带来不便，像是一开始的居家令，但是他们对于拯救宝贵的生命起到重大的作用。种种的努力，我们再次感谢大家，是您保护了这个社区，您的朋友和家人。目前我们处于稳定的阶段，病例率和确诊率都持续的下降，这意味着社区中新冠肺炎的流行下降了，人们暴露于病毒的可能性低于11月以来的水平。但是我们不敢松懈，我们持续密切关注指标，来确定还有什么是县府和社区必须随时应对的。有一点值得关注的就是 Omicron 的亚型变异株 BA.2， 目前已经成为主要流行的病毒株。这个 BA.2 传播更快速，再加上对于防疫的松绑，可能会导致一波新的疫情，亦或是又会有新的变异病毒的兴起。因此，我们需要地方的医疗保健提供方负起责任，提供民众更方便的检测和打疫苗的机会。联邦政府的经费已经暂停，这将影响疫苗接种和治疗的工作。我们需要获得持续的支持，来继续我们好不容易已经建立起来的基础设施。我们需要来自更多不同层级政府的协助。很多人想要知道，是否还需要接种更多的加强针？这点我们将会按照 CDC 的指引，如果需要，也会做好准备来为民众施打。我们的室内口罩令和州政府的维持一致， 但是州和县政府都强烈建议您在公共的室内空间能够继续的戴口罩。要提醒大家的是，有新冠肺炎症状的人应该赶快去做检测，而做检测是每一个人的权利。也建议您在家里面存放一些快筛检测剂，以防不时之需。如果您符合条件，建议您去接种加强针。更多新冠相关的讯息，请上网站 scc.gov.org/covid-19。最后，未来是不确定的，我们无法预测将来会发生什么，但是我们知道，只要我们做好准备，就能够随时的面对挑战。祝大家有个愉快健康的周末。Thank you。
Kính thưa quý vị, hôm nay hạt Santa Clara mở cuộc họp báo để đánh dấu 2 năm kể từ ngày 15 tháng 3 năm 2020 là ngày hạt Santa Clara ban hành lệnh y tế đầu tiên yêu cầu mọi người ở yên trong nhà để giảm thiểu sự lây lan của siêu vi khuẩn gây dịch bệnh COVID-19 và sau đó đã ban hành hàng loạt các lệnh y tế cũng như các biện pháp phòng ngừa. Hạt Santa Clara xin được cảm ơn cư dân đã đóng góp nỗ lực trong suốt thời gian đại dịch COVID-19 và cũng nhờ nỗ lực đó của cả cộng đồng mà chúng ta đã bảo vệ được rất là nhiều sinh mạng. Ngay cả khi chúng ta áp dụng rất là nhiều phương cách để bảo vệ, vẫn có hơn 2.000 người trong quận hạt đã mất mạng vì đại dịch. Nếu chúng ta cùng có một tỷ lệ như phần còn lại của quốc gia thì con số này sẽ lên đến hơn 5.000 sinh mạng, tức là 2.5 lần nhiều hơn nếu chúng ta không nhờ việc đã cùng nhau đoàn kết để ứng phó vì lợi ích chung. Nhờ sự quyết tâm này, quận hạt của chúng ta là quận hạt lớn đã có số người được tiêm ngừa cao nhất với tỷ lệ 85% và đã có 70% đã tiêm liều hỗ trợ. Những phương cách bảo vệ này có thể đã gây khá nhiều bất tiện nhưng cũng đã đóng một vai trò hết sức quan trọng trong việc bảo vệ được hàng ngàn nhân mạng trong hạt Santa Clara. Chúng tôi xin cảm ơn quý vị vì đã giúp bảo vệ các cộng đồng dễ bị tổn thương nhất, cũng như bạn bè và gia đình của quý vị. Hiện nay, vì tình thế đang ổn định, tỷ lệ nhiễm và dương tính đã hạ thấp và tỷ lệ lây lan và xác suất nhiễm bệnh hạ thấp hơn hồi tháng 11 vừa qua. Nhưng chúng tôi vẫn tiếp tục theo dõi các chỉ số để xem có điều gì chúng ta cần phải làm thêm hay không và để quận hạt cũng như cư dân được sẵn sàng ứng phó khi cần thiết. Ngoài ra cũng có một số lĩnh vực cần quan tâm như là biến thể BA2, BA2 đó, hiện nay đang đứng đầu trong việc gây lây nhiễm. Biến thể này lây nhanh hơn và khi chúng ta nới rộng các giới hạn thì có nghĩa là sẽ có một đợt bùng phát mới hoặc chúng ta có thể thấy một biến thể mới xuất hiện. Vào thời điểm đó, việc các nhà cung cấp dịch vụ chăm sóc sức khỏe phải đóng góp tích cực vào việc tiêm ngừa và xét nghiệm là điều rất quan trọng. Việc tiêm ngừa và xét nghiệm COVID-19 cũng phải được dễ dàng như khi chúng ta đến bác sĩ để được tiêm ngừa đậu mùa, uốn ván hay là cúm mùa. Và tài trợ của liên bang hiện đang bị đình trệ và đã ảnh hưởng đến các nỗ lực tiêm ngừa và chữa trị. Trước đây, chúng ta thường cũng có những chu kỳ như vậy. Chúng ta lại có được sự giúp đỡ của liên bang sau thời gian dài không được hỗ trợ. Và chúng ta cần hỗ trợ hạ tầng cơ sở mà chúng ta đã xây dựng được và không để cho nó bị sụp đổ. Chúng ta rất thành công trong việc ứng phó với đại dịch, nhưng cũng sẽ cần được sự tiếp tục ủng hộ của các cấp chính quyền. Có nhiều thắc mắc, liệu hiện nay chúng ta có cần phải tiêm thêm liều hỗ trợ nữa hay không? Thì chúng tôi sẽ tuân theo hướng dẫn của CDC, tức là Trung tâm Kiểm soát và Phòng ngừa Dịch bệnh, và sẵn sàng tiêm thêm liều hỗ trợ này khi cần thiết. Chúng ta sẽ tiếp tục tuân theo các hướng dẫn của tiểu bang về việc mang khẩu trang tại các không gian bên trong nhà. Việc mang khăn che mặt tại các không gian bên trong nhà vẫn được tiểu bang và quận hạt triệt để khuyến khích. Và xin quý vị, để tìm thêm thông tin, hãy lên trang covid19.scc.gov.org để tìm những thông tin mới được cập nhật. Và ngoài ra, hiện nay chính phủ liên bang đang có đợt phân phối các bộ xét nghiệm kháng nguyên, và xin quý vị hãy ghi danh vào trang covidtest.gov để xin những bộ kháng nguyên này gửi về tận nhà cho quý vị. Và nếu mà quý vị thuộc về 10% của những người đã đủ điều kiện để tiêm ngừa nhưng chưa tiêm ngừa, thì xin quý vị hãy tìm giải đáp cho những thắc mắc của mình và hãy đi tiêm ngừa ngay. Hoặc là xin quý vị hãy đi tiêm liều hỗ trợ nếu chưa tiêm liều hỗ trợ và đã hội đủ điều kiện. Tương lai của chúng ta vẫn còn mờ mịt và chúng ta không thể đoán trước được chuyện gì sẽ xảy ra trong tương lai. Nhưng mà chúng ta có một điều biết rất rõ, đó là khi có thử thách thì chúng ta đã biết cách đoàn kết, chung tay trong cộng đồng để bảo vệ lẫn nhau. Xin cảm ơn quý vị. Chúng tôi là Như Hạnh, nhân viên truyền thông của quận Hạt.